if I could go back in time, I would definitely say like to myself, like, take your hands off and figure it out. And I think the biggest thing, because at that moment, I wouldn't know what is right or wrong, but it would be to trust your gut and be very careful of cheap solutions, or people who are offering this like 5-minute fix, because and that goes. I mean, it could be a 5-minute fix, but it could be like I did, for example, a carpal tunnel release surgery when I was feeling quite desperate about my situation, and that was another example of something where I really wanted it to be true. I wanted it to be where I could just go in and that was it. It was like the carpal tunnel was squeezing the nerve, and all you had to do was nick it. And there's quite a lot of people ready to sell you this idea. And again, like with every piece of poison, there's like a little bit of truth to it. Maybe there are some people who they do have the nerve compressed there and they do well. I mean, it seems to be the case, because I did ask a lot of people who had gotten that surgery, and a lot of them said that it helped them. But it's also true that I asked a lot of people and they said it did not help them, and that they're many years down the line and they have had no relief. And when I did the surgery myself, that's the only thing that I can really speak to. I certainly did not feel any relief of my symptoms. And that happened about 4 months ago. So it's true, that there's a recovery process from the surgery, and it causes, something where you incur costs, and then over time it should get better. But I was told that I should feel better after 3 months. And by the people who did say that they felt better after the surgery, they told me that although they had the pain from the surgery, there was some sort of symptoms that they had that went away immediately, because the nerve at that, if that is the case, then the nerve should be released right in that moment. And so, you might have like a new pain, but there's some sort of sense of relief. And I never had any of that. It just gave me what I understand as a new complication. And the surgery in my mind was done very well. It just, I don't think it was helpful. I don't think, surgery, there was no infection. There was no like nick of the nerve. It was a good incision, I guess, but it just wasn't, I don't believe that it was the cause of my symptoms. And so it just added a complication and didn't help anything.
If possible, it's really good for people to get a second opinion, sometimes a third opinion, to first of all, really be sure that it's carpal tunnel syndrome and not something else. And the doctor with whom I wrote the first book, and also other doctors I respect, talk about the importance of posture, because if you have a forward head, that can lead to nerve compression in your neck that nourishes all the nerves in the median nerve and the ulnar nerve down the road. So the problem may be in the neck, not the carpal tunnel. So that's another thing where it really takes a skilled clinician to do the proper test. The physician with whom I wrote my first book would always encourage people to do aggressive physical therapy. This does not mean painful physical therapy. It just means a lot. Really get in, do the physical therapy, then work on your posture. And a lot of times that could resolve things and turn things around, because any surgery is pretty serious. And sometimes you really need the surgery, because otherwise things can go very wrong. So there are cases where you really do need the surgery. But I think it's good if people are aware that they could try something else, that they could get a second opinion, find a trusted physician to help guide them through.